So last but not least, we have more good news here. Um, from what I heard before we started the interview. Um, tell us your good news, and what are your plans for the future? What do you hope to accomplish personally, and what do you hope to see within the healthcare industry, medical field as a whole in the future?
As a whole. Okay. So I guess personal news. So I did get offered a job to work at the Urban Indian Health Institute, which is in Seattle, Washington, to be an epidemiologist there, which is awesome because I get to do something in my field and I get to do something that I enjoy, working with a population of people that I want to work with. And I don't know. I feel like long-term and short-term outcomes, like right now, at least if you had asked me this like early last year, might have been very different than
Mm.
currently. Currently, I'm just like, I'm hoping that people get vaccinated, that they continue to wear their mask and distance 6 feet apart. I personally have had COVID, and it's not fun at all. It was very brutal couple of days. So definitely mask up and practice distancing and, get the vaccine. I know there's a lot of vaccine hesitancy, but, coronaviruses have been studied for a long time. So,
Mm-hmm.
get it, get both of your shots and, try to do what you can for the greater good. Um, Other things that I would like to see, like personally, I would definitely like to see the, reduction of birthing inequities within the United States. Birthing should not be something that equates to death. That should not be something that you have to think about. So definitely a lot more support for that, especially from the federal government themselves. They can do a lot to kind of help reduce those numbers. Even within like medical teachings, teaching about racism and how medical racism does lead to deaths, especially for people of color, for Black people. Like we're seeing it now, the inequities going on with COVID itself. A lot more Black and Hispanic Latinx are dying from this disease, even though they don't make up a huge portion of the population, and that's extremely unfortunate. So that's what I would like to see. Definitely a reduction of the inequities, making more of an effort to be health equitable, especially in the United States. We spend so much money on healthcare, yet I don't know that we have a whole lot to show for it. I mean, we do have a really great advances in like medical technology and that, but I mean, if not a lot of people have access to it, then it's not really benefiting the entire population. So that's what I'd personally like to see. Um, I guess if we're going back to personal news, maybe getting my DRPH in public health and like being a doctor in public health and focusing on the maternal and child care. Yeah.
Well, those are pretty solid goals, if I do say so myself.
Mm-hmm.
Um, Going back to what you just mentioned about the inequalities between different races. Um, so basically, from what I'm understanding, is that it's not an issue of money as far as just, we're going to spend a lot more money on research, or, because the facilities in theory already exist. It's just more about access and education. Would you agree with that?
I would agree, definitely. Access to care, not having access to care is a huge barrier. And I would say education too. It goes both ways in this case. For patients, I think during my fellowship, I presented an article on health literacy and how in the United States, it's at a middle school level for health literacy. So making sure to have like more open conversations with your physician. Ask them those questions. I think I saw like a video on Twitter where a physician was saying that, if you have an idea about what's going on with your body, come in with that. Let them know. because you know your body quite well, and you know they can run tests, and you guys can have a more open conversation about it. But to even have that conversation, you need to be able to see a doctor.
Right.
Not just going to the hospital, but actually going to your physician. I mean, in the United States, we do it every year. In other countries, doesn't have to be done every year. But seeing them and talking to them, and not being concerned about, can I afford to do this month?
Mm-hmm.
Can I afford to have medication this month?
Mm-hmm.
And stuff like that. But yeah, definitely access is a huge, huge problem.
Yeah, I think just in general, nobody should ever have to value their own health, you know, over, well, can I afford this? Can I not afford this? And I've made those decisions too, and say, yeah, maybe I'll go, maybe I won't. I don't
Yeah.
know. Um, and also, I think the what you mentioned about communication is important. I have a friend who didn't tell his doctor, about his he was having some sort of stomach issue, and it turned out he was lactose intolerant, and he didn't know because he was either embarrassed to mention it or wasn't 100% sure. So, being willing to have those conversations, addressing things that are may seem like a small issue, but if you a lot of times with cancer, if you don't notice it right away, it
Right.
becomes more of a problem than it had to be. So thank you for sharing that. Last but not least, just on a job perspective, because a lot of these interviews are starting to focus more on what different jobs and fields people are in, and why they chose those things. What advice would you have for people who are interested in working in the healthcare industry?
Just know that the healthcare industry is large. There's like so many different things that you can do. So don't just limit yourself to one thing. There's so many different aspects to it. Just alone from like the medical side, if you do want to be a doctor, nurse, PA, nurse practitioner, that is also an option. There's also policy options within there too. Policymakers, you know, are a huge part of what makes the medical field run. So you can do policy, whether that is hospital policy, or whether it is higher up on the legislative totem pole. That is also an option for you too. There's also environmental healthcare. Where people live matters. The kind of housing conditions that they have matters. So looking into that, and it doesn't necessarily just have to be healthcare focused. I know that one of my interviews that I did with an ORISE fellow with the CDC, he was I think it was an engineer of some kind, but he works with the CDC because one thing with waterborne diseases, especially when he was focusing on Legionella, it happens because of coolant systems, so air conditioning,
Hmm.
hot tubs. There's so many different aspects that you can do, even more technical, like hospital machines. Those technicians make a whole lot of money. They do a really great job. They really do. And then you could also be epi-focused. There are so many different subdivisions within epidemiology that you can focus on within your disease. You can do global health, women's health, children's health, looking at HIV. HIV is always a big focus as well. Geriatric populations and stuff. So there's just so much within the field. I feel like we don't do a good enough job of showing other people that, hey, you work in healthcare, you don't just have the option to be a doctor. There are
Mhm.
so many other places that you can go. Um, and they all work within the healthcare system.
Yeah, I think that's a great point. A lot of different things are tied to healthcare, whether it's, being an engineer, um, being a doctor, studying, doing research, or even if you work for an NGO or something and you're just trying to improve access and you're not doing surgery, you're just, trying to spread the message. So I think that's an important point. And even, when you were talking to me about your research, stuff that I would never even have considered, studying or doing. but it's all very interesting. So again, thank you for coming on. Oh, you can even study salmonella if you want to.
Oh yeah, you definitely can. It happens. There are outbreaks all the time in the United States. So,
Yeah,
you know,
don't lick any turtles.
I hope
Okay,
nobody's doing that.
well, you'd be surprised.
Yeah. Mhm.
So thank you again for participating. Congratulations on the masters and the new job. I will definitely have to visit you once I'm out there. So keep me posted on when you're moving. Thank you again. Good to see you. And yeah, I appreciate
Yeah, well, thank you so much for having me. This was very fun. I was nervous about it. I was like, what am I going to say?
it. Well, you you did a great job, and it's always great to catch up with you. So thank you for that.
Yeah, it's been a pleasure.
Goodbye.